I'm Joe Graydon.
And I'm Terry Graydon. This People's Pharmacy podcast is supported in part by CocoVia. CocoVia cocoflavanols support both cardiovascular health and cognitive function. They promote healthy blood flow, which transports oxygen and nutrients to vital organs and muscles, including your heart and brain.
Now you can save $15 on any CocoVia powdered mix. Both the CocoVia original flavor mix and the CocoVia unsweetened dark chocolate powdered mix are included in the sale. Just use the code all uppercase, powder15 when you check out from cocovia.com.
Kick off summer with a strong heart and brain. The dark chocolate flavor is a great addition to your breakfast smoothie or morning coffee. But don't delay. The sale lasts only through Friday, June 4th.
That's any powdered mix at cocovia.com. COCOAVIA.com. The code is uppercase powder15. There's been a dramatic increase in the incidence of Parkinson's disease. What's behind the rise in this neurological disorder? This is the People's Pharmacy with Terry and Joe Graydon.
The pesticide chlorpyrifos, the herbicide paraquat, and the industrial solvent trichloroethylene have all been linked to a higher risk for Parkinson's disease. Have you been exposed to any of them?
The early symptoms of PD can be nonspecific and include constipation or a loss of the sense of smell. Perhaps that's why it can take so long to get a clear diagnosis.
Some exercises can be quite helpful for this movement disorder.
Coming up on the People's Pharmacy, preventing and treating Parkinson's disease.
In the People's Pharmacy Health headlines, recovering from COVID-19, even if the infection was mild, leaves people with protective immune cells and antibodies against the virus. That's the conclusion from a study conducted at Washington University in St. Louis and published in the journal Nature. The scientists found antibody-producing cells in people's bloodstreams nearly a year after the original infection. In addition, immune system cells called plasma cells were found in the bone marrow. These cells produce specific antibodies to SARS-CoV-2. The bone marrow of people who never had COVID-19 did not harbor such antibody-making plasma cells. The researchers emphasized that vaccination can provide additional protection, even for those who have recovered from mild cases of COVID-19.
Some sunscreens are contaminated with a cancer-causing chemical, according to the pharmacy testing laboratory Valisure. In a test of numerous sunscreen products, the company found that several contain relatively high levels of benzene, an industrial solvent. Sunscreen ingredients may be absorbed through the skin. Therefore, the presence of benzene at levels much higher than the permitted 2 parts per million is of serious concern. The company has submitted a citizen petition to the FDA requesting recall of contaminated sunscreen and after-sun products. Because many other sunscreens do not contain benzene, this compound is not deemed essential for their manufacturer. The petition quotes experts that, quote, there is probably no safe level of exposure to benzene.
A drought in New England led to a drop in the number of ticks last year, but this year is expected to be a worrisome tick season. Maine has already experienced a dramatic increase in tick-related emergency-related visits compared to this time last year. An early report from Connecticut suggests that ticks there are also more numerous. Lyme disease, after all, is named for the town of Lyme, Connecticut, where it was first identified in 1976. Lyme disease has now spread from New England to the upper Midwest, with some cases as far south as Florida. It has also been identified in California and Washington state. The black-legged tick, also known as the deer tick, spreads Borrelia burgdorferi in the U.S. This tick can also transmit anaplasmosis, babesiosis, and Powassan virus disease. Because of a relatively mild winter, tick season could be especially bad this year.
The DASH diet, dietary approaches to stop hypertension, has been shown to lower blood pressure. This dietary approach involves lots of vegetables, fruits, and whole grains. Low-fat dairy products are encouraged along with fish, poultry, nuts, and legumes. Processed foods, especially sweets and red meat, are minimized. A new study demonstrates that the DASH diet can lower cardiac inflammation. Combining a DASH approach with sodium limitation can also reduce measures of cardiac injury and strain. The researchers provided meals for the 412 participants so that they had complete control over what people were eating.
When do you exercise? Are you a morning person or do you prefer afternoon workouts? A new study recruited overweight men and monitored changes in their blood sugar, serum lipids, fitness, and blood pressure. The volunteers were randomly assigned to exercise in the morning, the evening, or not to exercise at all. They ate a high-fat diet. Exercise at either time increased cardiorespiratory fitness and lowered insulin levels. But overnight blood sugar control improved only for those who exercised in the early evening.
Regular physical activity can reduce the risk of atrial fibrillation and stroke. That's the conclusion of a new study involving nearly 100,000 Britons. All of the volunteers wore wrist-based accelerometers for a week. Then researchers kept tabs on their physical status over the next 5 years. People whose accelerometers registered higher levels of physical activity were less likely to experience AFib heart rhythm problems that can lead to stroke. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Cases of Parkinson's disease are growing at an alarming rate. This neurological condition causes a great deal of disability due to movement difficulties and other neurodegenerative problems. You may have heard of Parkinson's patients, including Michael J. Fox, Muhammad Ali, Alan Alda, Neil Diamond, and Janet Reno. What's behind the rapid increase in PD?
To find out, we turn to Dr. Ray Dorsey. He's the David M. Levy Professor of Neurology at the University of Rochester, where he directs the Center for Health and Technology. For the past decade, he's been using telemedicine to improve care for people with Parkinson's disease. He's co-author of the book, Ending Parkinson's Disease, A Prescription for Action.
Welcome to the People's Pharmacy, Dr. Ray Dorsey.
Thank you very much for having me, Terry and Joe. Delighted to be with you.
Dr. Dorsey, you have been quoted as saying that when it comes to Parkinson's disease, quote, we're on the tip of a very, very large iceberg. Why did you say that?
Because Parkinson's disease is the world's fastest growing brain disease. Today, 200 Americans will be diagnosed with the disease and 100 people will die with the disease. And we think that many of the reasons that are driving the rise in Parkinson's disease are environmental causes that are around us, including certain pesticides and industrial chemicals like trichloroethylene.
Is that why it's increasing so rapidly?
We're not sure, but I think that is. So over the last 25 years, the number of people with Parkinson's disease worldwide has more than doubled to about 7 million. Absent change will double again in the coming 25 years. As longevity increases, it allows the damage that's likely being done by these environmental risk factors to become manifest. The analogy I like to use is to smoking. You don't smoke and then develop lung cancer the next day. It takes years of smoking, and then you develop lung cancer, 25 years later. And I think with some of these industrial chemicals, trichloroethylene and certain pesticides, people have been exposed to them for long periods of time, often perhaps when they were a child. And as they live longer, is allowing time for these chemicals to do their damage in the body and in the brain, and for Parkinson's disease to become apparent.
Dr. Dorsey, Parkinson's disease has been with us for quite a long time. Actually, when I was growing up, I lived in rural Pennsylvania, and the next door neighbor was a farmer, and he grew corn and other vegetables right next door to us. And I remember when he was probably in his late 50s, early 60s, he started to shake. And eventually he was diagnosed with Parkinson's disease, and he had a real hard time walking. And as a child of about 6, 7, 8 years of age, that was pretty scary. Are farmers more susceptible to Parkinson's disease?
Yeah, so numerous studies in all different parts of the world have demonstrated that farmers and those who live in rural areas and those individuals who drink well water and those individuals who are exposed to pesticides are anywhere from 50 to 150% more likely to develop Parkinson's disease. And since you know farmers, you know many of these farmers tend to be the strong silent types, and many of them suffer in silence, don't pursue diagnosis, and are often undertreated and for disease that can be very treatable, especially in the early stages of the disease.
Dr. Dorsey, perhaps we should really look at what Parkinson's disease is and what are the symptoms so that we're all very clear on what we're talking about.
Yeah, so classically, Parkinson's disease is considered a brain disorder that affects tremor, usually a shaking in one hand more than the other, slowness in movement, often difficulty buttoning buttons, for example, stiffness, and difficulties with walking or balance. As it turns out, this really smart German pathologist Heiko Brack in 2003 postulated that Parkinson's disease may not begin in the brain, that it might actually begin in the nose or the gut. And so it turns out that years, if not decades before the classic tremor appears in Parkinson's disease, people lose their sense of smell, much like they do in COVID, and they develop constipation. And I think these early symptoms of Parkinson's disease, loss of smell and constipation, can give us clues as to where Parkinson's disease is beginning and how Parkinson's disease is entering the body.
Now, men versus women, it's my understanding that men are more vulnerable. Do we know what the ratio is and how much more vulnerable?
So I'm not so sure it's vulnerability, but men are more likely to have Parkinson's disease, especially in Western Europe and the United States, and numerous studies have confirmed that. And they're about 40 to 50% more likely to develop the disease. Some laboratory studies suggest that estrogen might be protective of nerve cells. I tend to think that the difference in the sexes is primarily sociological, not biological. So farmers, at least in the United States, are more likely to be men than women. About 75% of farmers in the U.S. are men. Men are more likely to work with these industrial chemicals like trichloroethylene, widely used in dry cleaning and degreasing. And men are more likely to sustain head trauma. So I think it's sociological reasons more than biology that's driving these differences. Indeed, there's even one study in Japan suggesting that Parkinson's disease is more common in women than men. And when I did a little research, it turned out in Japan, until recently, more women were doing farming than men in Japan.
What about age?
So age is a huge risk factor for Parkinson's disease. So most cases of Parkinson's disease begin after age 50, although there's certainly prominent individuals who develop the disease before then. You can think about Michael J. Fox, for example. Age, as I alluded to, I think allows the disease to become apparent. Just like if everyone died at 40, we'd have very few cases of lung cancer and we'd have very few cases of Parkinson's disease. As I discussed, Parkinson's disease, some of the earliest symptoms are loss of smell and constipation, and those occur decades before the tremor and slowness of movement take place. And it may take years or decades for the pathology to move from the nose or the gut to the brain, at least for some individuals with Parkinson's disease.
Now, Dr. Dorsey, you mentioned that people who live in rural areas and people whose water comes from wells may be more susceptible to Parkinson's disease. Are there other risk factors we should all be aware of?
So well water is a concern. About 40 million Americans, 1 in 8, currently get their water from wells. In the past, it may have been even higher. And wells tend to be in rural areas, which tend to be near farms. And so even if you're not a farmer per se, pesticides used on nearby farms can often contaminate the groundwater and contaminate private wells, as can this industrial chemical called trichloroethylene, which contaminates up to 30% of groundwater in the United States. And private wells, as opposed to like city water, are not regulated by the Safe Drinking Water Act. And so they're not routinely tested for pesticides or chemicals, and often only done so when people buy or sell their homes. Other environmental risk factors are head trauma, as I alluded to. And then there are some genetic causes of Parkinson's disease. About 15% of people with Parkinson's disease have a family history of the disease. These genetic mutations tend to be more common in individuals of Ashkenazi Jewish descent, and those can be important risk factors for developing the disease as well.
Dr. Dorsey, you mentioned trichloroethylene as a potential water contaminant. Can you tell us more about that? And specifically, can you tell us about one of the cases that you mention in your book, Ending Parkinson's Disease, Danny Fromm?
Yes. So Danny Fromm was a high school teenager in Southern California when the aerospace industry was hot. And after graduating out of high school, his buddy got a job at a local technology firm and got his friend Danny a job. And he started using trichloroethylene to clean off circuit boards. And those days, he didn't use any protection at all with the chemical, and he would just literally pour it on the circuit boards and his hands and wash it off. And he worked in this company for about 8 years. And then in his early 30s, he noticed that his right pinky finger started to twitch. He saw an initial physician who thought it was just from stress and recommended a little wine. And a second doctor gave him a much different diagnosis, that of Parkinson's disease. He's subsequently treated with medications, including levodopa, which is highly effective for Parkinson's disease, and then had surgery done, and today lives in Idaho with his family and been battling Parkinson's disease for the last decade or so. TCE, widely used, according to the New York Times, it was ubiquitous in the 1970s, used in everything to decaffeinate coffee. Anyone who drank Senka in the early 70s may have been exposed to TCE. Used as a carpet cleaner, used as a degreasing agent, used in paints, wide range of uses for the chemical, including some consumer goods.
How long have we known that TCE poses a risk, A, and B, is it still out there? Yeah, so TCE was created in the 1920s. So the analogy I like to use is, few of us fly in airplanes or drive cars from the 1920s because we have safer alternatives. And, you'd think we'd have safer alternatives for TCE, and indeed some companies advertise that they have safer alternatives for it. The health risk of TCE have been known at least since 1932. Dr. Kerry McCord, a physician working for Chrysler Corporation in my hometown of Cincinnati, Ohio, sent a letter to the editors of the Journal of American Medical Association, which was published, entitled The Toxicity of Trichloroethylene. And he said that basically I had rabbits inhale TCE and they died, and I put TCE on the skin of rabbits and they died. Right. And he sent that letter in 1932. So for almost 90 years, we've known about the toxicity of trichloroethylene. And some countries in Europe have banned it. Some states, including Minnesota, have banned it. But the United States and the EPA have proposed banning it, but haven't done so to date. And there are still permissible uses. And TCE contaminates half of Superfund sites throughout the United States. These are the most contaminated sites in the country, and contaminates thousands of other sites around the country, including one 15 minutes from my house in Rochester, New York. You are listening to Dr. Ray Dorsey. He is the David M. Levy Professor of Neurology at the University of Rochester, where he directs the Center for Health and Technology. For the past decade, he's been using telemedicine to improve care for people with Parkinson's disease. He's co-author of the book, Ending Parkinson's Disease, A Prescription for Action.
After the break, learn how telemedicine can help people with Parkinson's disease.
Over the years, TCE in the environment damaged the health of a lot of people at Camp Lejeune, North Carolina.
How do doctors diagnose Parkinson's disease?
What drugs and non-drug treatments can be most helpful?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
The People's Pharmacy podcast is sponsored in part by Kaya Biotics. KAYA Biotics offers the first probiotics which are both certified organic and hypoallergenic.
All probiotics are produced in Germany under laboratory conditions with high-quality ingredients and under strict regulatory oversight.
The 3 available formulas are created for very specific purposes, such as strengthening the immune system, fighting yeast infections, and helping with weight loss.
To learn more about Kaya Biotics probiotics and the important topic of gut health, you can visit their website, KayaBiotics.com. That's Kaya Biotics.com. Use the discount code PEOPLE for $10 off your first purchase.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon.
The People's Pharmacy is brought to you in part by Kaya Biotics, organic probiotic products made in Germany. KAYA Biotics.com.
Also by CocoVia Memory Plus, a cocoflavanol supplement backed by 4 clinical studies that show significant improvement in 3 different aspects of memory. More information at cocovia.com.
Today, we are discussing the causes and treatments for Parkinson's disease. Cases have been rising steeply, but what we see now could be just the tip of the iceberg. The accumulation of certain chemicals in the environment may be contributing to an increased risk of this devastating neuromuscular disorder. There was a surge of Parkinson-like conditions following the 1918 flu epidemic. Nobody knows whether COVID-19 will also increase the chance of developing this problem.
Our guest is Dr. Ray Dorsey, the David M. Levy Professor of Neurology at the University of Rochester. He's the director of the Center for Health and Technology, which seeks to offer care to anyone, anywhere. For the past decade, he's been using telemedicine to improve care for people with Parkinson's disease. He's co-author of the book, Ending Parkinson's Disease, a Prescription for Action.
Dr. Dorsey, you see patients all over the country via telemedicine. Have you seen patients recently that might have been exposed to TCE?
Yeah, so we've been using video conferencing just like Zoom to care for patients with Parkinson's since 2007. And just before we were recording this conversation, I was seeing patients in Newark, Delaware, at the University of Delaware, a clinic run by nurse practitioners. And one of the unfortunate individuals I saw had Parkinson's at a young age, and her sister just recently passed from Parkinson's disease. And it turned out that they both grew up near a Superfund site in Delaware that was contaminated with trichloroethylene. And according to the EPA, TCE, or trichloroethylene, is a carcinogen by all routes of exposure. So when we start seeing, clusters of individuals with Parkinson's and cancer, it starts making me concerned about TCE. And at least in this one individual, we found a site right near where she used to live. Now, it's not proof that that's the reason why she has it, but certainly raises lots of questions.
It sure does. We are in North Carolina, Research Triangle Park. Our host station, WUNC, has reported on a problem not that far away from us, a military installation, Fort Lejeune. I wonder if you've ever heard about some of the problems of contamination there.
Yeah, well, Camp Lejeune is infamous for its contamination. So it's a Marine base in North Carolina. It's one of the large Marine bases, training bases in the country. And for 30 years, Camp Lejeune's groundwater was contaminated with TCE and a closely related chemical called PCE at levels up to 3,000 times that were safe. The Marines covered this up from the Marines who were being trained there, from their families, from the support population and civilian population. Over those 30 years, up to 1 million Americans were exposed to TCE in the water they drank, the water they used to bathe, the water they used to wash their children, and the water they used to cook. In addition, TCE contaminated some of the indoor air and some of the barracks at that site. Parkinson's is actually among the least among the better conditions to have with Parkinson's disease. There's a cemetery at Camp Lejeune that is filled with children who died either at birth or shortly after birth, some without brains on that Marine base. Retired Master Sergeant Jerry Ensminger served in the Marines for over 20 years and has devoted his last 20 years to bringing justice for those Marines, including his daughter who died of leukemia, likely from TCE when she was about 7 years old.
That is such a tragic story. I do want to switch just a little bit and talk about how Parkinson's disease is diagnosed.
Yeah, so Parkinson's disease is diagnosed in 2021, much like it's been diagnosed for the last 50 or even more years. It's predominantly diagnosed by an individual, a physician, a neurologist, someone familiar with Parkinson's disease, making the diagnosis based on the symptoms that somebody has. I have a 50-year-old man with a new onset tremor in one hand, for example, and on examination, looking for those cardinal features of the disease. Again, arrest tremor, slowness of movement, stiffness, and difficulties with gait or balance. Neurologists, even so-called experts like me, sometimes get it wrong. We're wrong about 10, maybe 20% of the time, and that it's a different disorder other than Parkinson's disease that is responsible for it. There is a fancy imaging test that's available to help differentiate Parkinsonian disorders from other causes of tremor that can be helpful.
Oh, when you say an imaging test, are you talking about taking a picture of the brain?
Yeah, it's called a DAT scan, dopamine transporter imaging thing that can identify if the dopamine producing nerve cells in the brain are lost, as they are in Parkinson's disease.
I'd like to talk a lot more about dopamine, but first, is there a simple test? I understand that if somebody tries to tap their thumb and pointer finger, that sometimes is a tip-off.
Yeah, so there are things that there's not a simple blood test or really simple imaging test. There is that can be helpful for diagnosing multiple sclerosis, for example, or heart disease. But there are things that we do in the clinic that are relatively simple. So we have people tap their thumb and index finger big and fast 10 times. And people with Parkinson's disease have reduced amplitude, smaller movements, and they often have pauses or interruptions. One of my colleagues, a mathematician in England, demonstrated in 2007 that sophisticated mathematical analysis of voice recordings, because people with Parkinson's disease have a soft voice, can differentiate people with Parkinson's disease from those without. So I think we're soon going to have technological ways to facilitate and enhance the accuracy of the diagnosis of the disease and make it more accessible to people.
Now, Dr. Dorsey, you mentioned in our first segment that constipation and a loss of the sense of smell could be red flags for Parkinson's disease. Do doctors ask about that?
I think Parkinson's specialists ask about them. I don't think the general practitioner would necessarily think that loss of smell or constipation are early features of the disease. As we've touched on, Parkinson's has hundreds of different symptoms, everything from depression and anxiety to sleep disorders to increased risk for skin cancer that are associated with the disease. And knowing the myriad of symptoms is overwhelming even for a specialist. But yes, loss of smell and constipation can be early markers for development of Parkinson's disease. Obviously, there are lots of other reasons that people have constipation, so I don't want everyone thinking that they have constipation, they have Parkinson's disease. But loss of smell is actually a concerning symptom for Parkinson's disease and other neurological disorders.
Well, Dr. Dorsey, when you mention loss of smell, I suspect a lot of people think COVID-19. That's one of the hallmarks, and loss of taste. So something weird about a virus, a viral infection, and these senses. And I'm wondering, you mentioned pollutants like pesticides, TCE, solvents, weed killers, groundwater contamination. But what about viruses? I mean, now that we have become so focused on COVID-19, is there any evidence that viral infection could cause or contribute to Parkinson's disease? What about 1918 influenza?
So 1918, right around the time there was the influenza pandemic, there was another disease. We're not even exactly sure if it was caused by the influenza virus or some other reason called a sleeping sickness. and it would attack often young people in their 20s and cause huge bouts of sleepiness, and often later lead to periods of immobility that become almost frozen in time. And some of these individuals later developed what looked like a Parkinsonian disorder. If any of your listeners have either read the book or watched the movie Awakenings, they have seen these individuals that Oliver Sacks helped care for in the 1960s. And these individuals who developed, again, a Parkinsonian disorder at a very young age, 20s, 30s, and 40s, and became frozen in place, had these awakenings in response to the most effective medication for Parkinson's disease called levodopa. But those are relatively rare cases. We're going back to 1918. There are some likely viruses that can cause Parkinsonism, and some people are concerned that COVID, in the long term could contribute to Parkinsonian symptoms, but those are generally just speculations at this point, and they likely only account for a small minority of individuals who've had Parkinsonism. Environmental causes and genetic causes are likely to be much more important factors.
Dr. Dorsey, how long does it usually take for someone to get a diagnosis? Is it something that is quick and easy, or, we hear about certain conditions that people may be seeing doctors and complaining about symptoms for months or years? Which is Parkinson's?
Yeah, so it can be frustrating, and not everyone's familiar with Parkinson's. Hopefully more and more clinicians are, but as we alluded to with even Danny Fromm, he got an incorrect diagnosis. So on average, it takes about 2 years from the time people develop symptoms and they begin pursuing a diagnosis until they get an accurate diagnosis of Parkinson's disease.
Now, Dr. Dorsey, as a pharmacologist, I learned about L-DOPA back in the early 70s. And so, here is a drug that has been used for a very long time. Why don't we have fancier, newer, far more effective drugs? We're still using L-DOPA to treat your patients.
Yeah, so one is it's a testament to the power of levodopa, is that 50 years after its development is still the most effective treatment for Parkinson's disease. But the corollary is, we have few diseases for which the most effective drug is 50 years old. We need more highly effective treatments for the 1.2 million Americans who have Parkinson's disease. I think in order to get those treatments, we need better measures of the disease. We highlighted, just the uncertainty around making the diagnosis of the disease. If we have uncertainty to make the diagnosis of the disease, we have uncertain measures or insensitive measures for measuring the progression of the disease. When we get better measures of the disease, we'll get better treatments faster for the 1.2 million Americans with the disease.
So L-DOPA, it helps the brain make dopamine. And dopamine is one of the critical neurotransmitters, if not the critical neurotransmitter, when it comes to Parkinson's disease. Can you tell us what's going on in the brain? And also another neurotransmitter I'm particularly fond of called norepinephrine.
Yeah, so Parkinson's disease leads to selective loss, or leads to loss of dopamine-producing nerve cells in the brain, and the levodopa is just a precursor to dopamine, and it's taken up by the remaining nerve cells and converted to dopamine, and can be a highly effective treatment, especially for people early in the disease course of Parkinson's disease. But as we've alluded to a few times, Parkinson's disease isn't just a loss of dopamine-producing nerve cells. Other neurotransmitters are affected, including some loss of norepinephrine, loss of another neurotransmitter called serotonin. And Parkinson's disease isn't just affecting motor circuits responsible for movement. They're affecting circuits responsible for mood. So depression and anxiety are found in about 40% of people with Parkinson's disease. They're affecting circuits that are responsible for controlling our autonomic nervous system, which regulates our blood pressure, regulates our bowels, regulates our digestion. So people with Parkinson's disease can get lightheadedness when they stand up, and they can get nausea because they have delayed emptying of their food in their stomach, and they can get constipation. So Parkinson's disease can be quite complex, affecting multiple neurotransmitters and multiple different circuits in the brain. And as disease progresses, more and more circuits are affected, so that even circuits responsible for memory and thinking can be affected in the latter stages of the disease.
Are there new treatments under development?
There are new treatments under development. There's a class of medications that are aimed at one of the more common genetic causes of Parkinson's disease, a genetic mutation called LRRK2, LRRK2. And it's hopeful that these class of LRRK2 inhibitors could be helpful for people with Parkinson's disease. Parkinson's disease is also characterized by having a misfolded protein in different parts of the brain, much like Alzheimer's disease. And so there are actually antibody treatments that are being developed that target this misfolded protein and the hope that they could clear them. But we need a lot more treatments for the world's fastest growing brain disease.
Are there some non-drug treatments that can be helpful?
Yeah, so by far the most effective non-pharmacological treatment is exercise. So the last 20 years have shown a renaissance in our understanding of the role of exercise in Parkinson's disease and a wide range of other conditions. Numerous studies, including a study published in the New England Journal of Medicine, demonstrated that Tai Chi was helpful for people with Parkinson's disease. We even know that vigorous exercise in your 40s, 50s, and 60s can decrease your risk of ever developing Parkinson's disease by 20%. So if you have Parkinson's disease, you should exercise at least an hour a day. And if you don't have Parkinson's disease and never want to develop the disease, 3.5 to 4 hours of vigorous exercise in your 40s, 50s, and 60s can decrease your risk of developing the disease by 20%.
Dr. Dorsey, we've heard that people who use a bicycle, like a stationary bicycle, and really push themselves, really work hard at it, or even people who start boxing, not to be professional boxers, but just to go into a situation where they are using their arms to box and their legs as well, that may have a benefit for people with Parkinson's.
Yeah, so the numerous studies have shown that everything from ballroom dancing to boxing non-head contact boxing can be helpful for people with Parkinson's disease. So there's something called rock steady boxing, in which people get into the ring and demonstrate improvements in their Parkinson's symptoms. Leslie Stahl actually filmed a 60 Minutes episode featuring her husband that was demonstrating the benefits of boxing for her husband. And bicycling, there's a great video clip by my colleague and co-author of our book, Dr. Bas Bloom, who showed that individuals who have significant difficulty walking can actually paradoxically be almost unaffected in their ability to bicycle. And then that individuals who do forced cycling, where they're pedaling on a tandem bicycle with somebody else who's bicycling at a more rapid rate than they are, that might even be helpful for people with the disease.
Dr. Dorsey, I have a good friend who's a tennis player, and I love playing tennis with him. He has pretty bad Parkinson's disease, but when he's on the tennis court, he can run, he can hit the ball. I mean, he's awesome at the net.
Yes. So it turns out that there are other motor circuits that we not well understood, whereby people can react really quite well with Parkinson's disease almost normally. And they do quite well. I bicycle every day or bicycle frequently with one of my friends who has Parkinson's disease, and he feels normal when he's on a bicycle.
You're listening to Dr. Ray Dorsey. He's the David M. Levy Professor of Neurology at the University of Rochester, where he directs the Center for Health and Technology. He's co-author of the book, Ending Parkinson's Disease, A Prescription for Action.
After the break, learn more about telemedicine for Parkinson's disease.
If healthcare truly put patients at the center of Parkinson's disease care, what would that look like?
How long does L-DOPA stay effective?
Are there things that people with early Parkinson's disease can do to slow the progression of the disease? A second or third cup of coffee would be easy. Does it really help?
What kinds of policy changes might be needed to reduce the risks and eventually end Parkinson's disease altogether?
You're listening to The People's Pharmacy with Joe and Terry Graydon. This podcast is brought to you by the Verrazana Health Club. This comprehensive home testing service enables you to track crucial health markers of gut health, inflammation, metabolism, hormones, thyroid function, and many other organ systems. Regular testing can help detect health imbalances before they lead to sickness. Online at Verisana, verisana.com/health-club. Get 50% off the first month with the discount code PEOPLE50. Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon.
The People's Pharmacy is brought to you in part by CocoVia Memory Plus, a supplement with 750 milligrams of cocoflavanols, the plant-based nutrients from fresh cocoa that help support memory. More information at cocovia.com.
And by Kaya Biotics, organic probiotic products made in Germany. KAYABiotics.com.
We're talking today about preventing Parkinson's disease as well as discussing its treatment. Do you rely on well water? Has it been tested for the presence of TCE or other toxic chemicals? Are there activities that are bad for the brain? What about ways that people can slow the progression of early Parkinson's disease? Exercise might help if it's tailored to the patient. What about coffee? Can such a common beverage really provide any benefit?
Our guest today is Dr. Ray Dorsey. He's the David M. Levy Professor of Neurology at the University of Rochester, where he directs the Center for Health and Technology. He's co-author of the book Ending Parkinson's Disease, A Prescription for Action.
Dr. Dorsey, you mentioned that you are seeing patients all over the country, that you've been using telemedicine since 2007. Can you tell us more about using telemedicine to treat people with Parkinson's disease?
Yes. So it turns out that 40% of Medicare beneficiaries, people over 65 in the United States with Parkinson's disease, don't see neurologists of any kind within 4 years of diagnosis. 40% of the people with the world's fastest growing brain disease in the United States don't see a neurologist of any kind. And those that don't are more likely to fracture their hip, more likely to be placed in a skilled nursing facility, and more likely to die prematurely. And if you think about it, it's kind of odd that in general we ask sick patients to come see healthy clinicians on our terms. In reality, it should be, generally healthy clinicians should be seeing sick patients on their terms. And telemedicine allows us to bring care to patients rather than patients to care. And if you have impaired mobility or impaired driving ability or overburdened caregivers, as is common with Parkinson's disease, or you live in rural areas that are far from urban centers where many specialists are located, telemedicine provides a bridge to address these geographical barriers to care. One of the silver linings of the COVID-19 pandemic was that Medicare vastly increased its coverage of telemedicine, allowing for care to be provided to people regardless of where they live, and allowing for care to be provided into the home, and allowing care to be provided not only from doctors, but from nurses and speech therapists and occupational therapists. Those changes are all temporary. We're hoping that Congress will take action to make those changes permanently to allow Medicare beneficiaries anywhere in the country to receive the care that they need.
Well, it sounds like this is consistent with a call you and your colleagues make in your book that there should be a paradigm shift that would put patients at the center of Parkinson's disease care instead of the professionals. What would that look like?
Yeah, so my colleague, Dr. Mike Oken, thinks that the patient should be the sun and everything else, including the clinicians, should revolve around the needs of the patient. And I think part of that is around where care is delivered. And some patients want to come to clinic and they enjoy the clinic experience. Some of my colleagues actually do house calls, traditional house calls where they visit patients directly in their home. And sometimes that might be via telemedicine. But it's not just doctors that patients need. They need speech therapists, physical therapists. My colleague, Dr. Bas Bloom, has listed 30-some specialists that people with Parkinson's can benefit from, psychologists for the depression and anxiety that they have. physical therapists to help them with exercise, speech therapy to help them with their soft voices. So the goal is to bring care from multiple different clinicians to patients on their terms, addressing their needs.
Dr. Dorsey, what is the time course of Parkinson's disease? I have a friend who was diagnosed a couple of years ago, and he was a little reluctant to start taking levodopa because he was afraid that it might wear off sooner. And so he delayed for maybe 6 months or longer before he started taking it. Now, it really did help once he started. So I think for a lot of folks, they're just wondering, if I delay, and then start taking the medication, maybe I'll get a longer benefit. Is that magical thinking?
It's mythology. First thing, if people get diagnosed, they should exercise. So there's almost no reason not to do exercise, and exercise might slow the rate of the disease. It might protect nerve cells by releasing growth factors that protect the remaining nerve cells that are there. By the time somebody's lost, 50%, half the nerve cells in the brain that produce dopamine are already lost. Second is if people are disabled by their symptoms, and some people aren't very disabled by their symptoms, but if they are disabled by their symptoms, levodopa is by far the most effective medication, and people shouldn't fear it. The main drawback with levodopa is that over time, people get complications from that medicines. They have too much movement. They have excess movements that are associated with the medicine, and they get periods where the medicine works well and periods where the medicine doesn't work well. There are treatments for when that does occur, but by and large, once people are feeling disabled by their symptoms, they should not be afraid. One, they should be exercising first, and two, if they develop disabling symptoms, levodopa is the most effective medicine for them.
Are there any other things that people with early stages of Parkinson's disease can be doing to slow the progression of the disease? Does diet make a difference? Are there supplements that can help?
There have been some supplements that have been evaluated, vitamin E and coenzyme Q10, but they've been shown not to be effective, unfortunately, and no known supplements are known to be effective. There's evidence that the Mediterranean diet, high in fruits and vegetables, low in animal products, can decrease your risk of ever developing the disease and be modestly beneficial for people with the disease. As I alluded to, certain pesticides are linked to Parkinson's disease, and so I buy a lot more organic fruits and vegetables since I've done the research for the book, and I wash all my fruits and vegetables to remove any pesticide or to minimize the amount of pesticides that I might be eating. There's also some evidence that caffeine, modest amounts of caffeine can be helpful, can either decrease your risk of the disease and be helpful for people with the disease. So if you enjoy your caffeinated coffee or your caffeinated tea, there's some evidence that can be beneficial for people with and without the disease.
What about turmeric or the active ingredient curcumin? There's a fair amount of talk about it as an anti-inflammatory. People talk that it might have some anti-cancer effects and maybe even might be beneficial against Alzheimer's disease or dementia. I don't think there's been great research, but I'm curious as to whether anyone has done anything at all in terms of Parkinson's disease.
There are, I think, a few studies in animals that have been looking at turmeric, but nothing substantial to my knowledge about the benefits of turmeric in Parkinson's disease.
I'd like to go back to exercise for a moment. You've emphasized how important exercise, vigorous exercise could be, including boxing, but there's also a caveat, and that is head trauma. So you don't want anybody hitting you in the face if you've got Parkinson's disease. And I'm wondering, well, what about, people who have developed pretty serious neurological conditions because they were boxers? And I'm wondering about other trauma. Is there any association there? And what about heading a soccer ball, especially for children?
So head trauma definitely increases your risk of Parkinson's disease. Probably the most famous person to ever have Parkinson's disease, Muhammad Ali, a boxer. We also know that in football players who have chronic traumatic encephalopathy, that about 40% of them will have Parkinsonian features as part of their disease: slowness in movement, shuffling gait, tremor. I think we have a lot of evidence to demonstrate that, sports with high rates of concussions are not good for you. So the biggest one in the United States is that about half of traumatic brain injury concussions are associated with football, American football in the United States. There are other sports that are also associated with head trauma. You're alluding to, soccer and volleyball and others. And we have a nice chart in our book which shows the relative rates of concussion in each of these sports. But I think we as a society should be thinking about, one, encouraging more people to exercise, everyone for a sport and a sport for everyone, and two, thinking about ways to have sports that have a lower risk of head trauma, not higher risks, because the long-term consequences of those head injuries is increasingly apparent to all of us.
What kinds of policy changes would you like to see so that we can, in fact, end Parkinson's disease?
So we need to get rid of these environmental risk factors that are fueling the rise of Parkinson's disease. There's a pesticide called paraquat, increases the risk of Parkinson's disease by 150%. Considered the most toxic herbicide ever created, kills the weeds that Roundup doesn't. The EPA's own website says that one sip can kill. 32 countries, including China, have banned the pesticide, but the United States hasn't.
Whoa. Dr. Dorsey.
Not banned paraquat?
Are you kidding me? The United States has not banned this herbicide?
No. And in fact, in October of last year, they renewed its approval.
Now, am I getting this wrong? I seem to remember that somebody was using paraquat, some governmental group was using paraquat against suspected patches of marijuana. Is that true?
Yes. So in the 1970s, I believe, don't quote me on this, that the United States government was using paraquat to, I think, kill marijuana being produced in Mexico. There's even a scene from the movie The Big Lebowski where they're talking about having paraquat tainted marijuana. But yes, paraquat is still used, banned by over 30 countries, including China, the United Arab Emirates, Syria, but still used in the United States. Not only still used, use of the chemical has tripled in the last 25 years, doubled in the last 10 years, and increased 20% in the last year, for which data are available.
So why aren't all of your neurology colleagues picketing in front of the EPA or in front of Washington saying, help us stamp out Parkinson's disease? Let's prohibit paraquat. And why aren't we paying attention?
That's why we wrote the book, is to sound that alarm. And it's not neurologists who changed the world. My guess is most people can't even name a neurologist. But people who changed the world are ordinary Americans. So ordinary Americans in 1938 created a March of Dimes in which they mailed dimes into the White House to raise millions of dollars to end polio, and they were successful. In the 1980s, we confronted an unknown, uniformly, rapidly fatal disease and virus, and groups of activists in San Francisco and New York rose up and made their voices heard to end HIV. They adopted the motto of silence equals death, because for them, silence did equal death. And for Parkinson's, silence doesn't equal death, but it equals suffering, needless and preventable suffering. And until the 1.2 million Americans and their friends and families make their voices heard, we're going to be confronted with more cases of Parkinson's disease. But on the flip side, if we do make our voices heard, if 1.2 million Americans make their voices heard, they can go to endingpd.org and with resources to do that and contact the EPA administrator. My guess is that we can end and ban paraquat and prevent thousands, tens of thousands of people in the United States and around the world from ever developing this disease.
And that website again, please?
Is endingpd.org.
Now, a lot of our listeners are thinking, well, this affects somebody else. Maybe Michael J. Fox, but not me, not someone I know. And yet many of our listeners have well water. That's what they drink every day. And I think you said something about 30% of well waters contaminated. Is that right?
Yes. And I'll do some math for you. So in the United States, there's 5.8 million people with Alzheimer's disease and 1.2 million people with Parkinson's disease. That's 1 in 50 Americans have either Parkinson's disease or Alzheimer's disease. If individuals don't think that these diseases are going to affect them, they're just not well informed. My lifetime risk of developing Parkinson's disease as a middle-aged physician with no family history of Parkinson's disease is 1 in 15. My lifetime risk of dying in a car accident is 1 in 100. So I drive a safe car, I wear a seatbelt, and I have a car with airbags. My lifetime risk of dying with Parkinson's disease is 6 times higher than dying in a car accident. And we should be asking ourselves, what are we doing to prevent this from happening? And so we're not banning pesticides that are linked to the disease. We're not banning trichloroethylene, which contaminates up to 30% of the groundwater in the United States and is responsible for numerous people having cancer and Parkinson's disease, both in the United States and around the world. We're not combating air pollution as effective as we should be in many parts of the world. And we're fueling the rise of Parkinson's disease.
So we should be paying attention to all of those things. Dr. Dorsey, do you have a crystal ball? What would you like to see in the future?
So when we started this red letter campaign asking people to mail a postcard to the White House, they can go to endingpd.org to do so. We asked them to ban paraquat, another pesticide called chlorpyrifos, which costs children IQ points, and the chemical called trichloroethylene, so that we can prevent the disease. Second, we asking that Medicare make its coverage of telemedicine permanent so anyone, anywhere can receive the care that they need. And third is we're asking for a 10-fold increase in funding for Parkinson's disease research. We saw what an Operation Warp Speed could do for COVID-19. We should see what an Operation Warp Speed can do for Parkinson's disease.
Dr. Ray Dorsey, the title of your book is Ending Parkinson's Disease. Do you see a day, maybe even within your lifetime, when we actually can put an end to this devastating neurological condition?
Yes, and the best way to end these diseases is to prevent them in the first place. In the United States, there is no more polio. So some of your listeners were around when their swimming pools and community centers and houses of worship were closed due to polio in the 40s and 50s. There are thousands, if not millions of us who don't have HIV because of the bravery and courage of HIV activists who rose up in the absence of any federal response and made their voices heard, found out what caused HIV, and found ways to prevent the disease from spreading. We need the same activism to happen with Parkinson's disease. If we don't, we'll continue to see Parkinson's disease cases increase. If we can first prevent people from ever developing the disease, and the best way to end the disease is to prevent it in the first place.
Dr. Ray Dorsey, thank you ever so much for talking with us on the People's Pharmacy today.
Thank you very much, Terry, and thank you very much, Joe.
You've been listening to Dr. Ray Dorsey, the David M. Levy Professor of Neurology at the University of Rochester. Dr. Dorsey is helping investigate new treatments for movement disorders and improve the way care is delivered for individuals with Parkinson's disease. Using web-based video conferencing, he and his colleagues are seeking to provide care to individuals with Parkinson and neurological diseases anywhere they live. He's co-author of the book Ending Parkinson's Disease, A Prescription for Action.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
The People's Pharmacy is a co-production of North Carolina Public Radio, WUNC.
People's Pharmacy is brought to you in part by CocoVia Memory Plus, a cocoflavanol supplement backed by 4 clinical studies that show significant improvement in 3 different aspects of memory. More information at cocovia.com.
And by Kaya Biotics, organic probiotic products made in Germany, KAYA-biotics.com.
Today's show is number 1259. You can find the podcast on our website, peoplespharmacy.com.
When you go to peoplespharmacy.com, you can share your thoughts about today's show in the comments section for show 1259.
You can also subscribe to our podcast through your favorite podcast provider. We post the show on our website on Monday morning. You might want to share it with a friend or family member.
At the website, you can sign up for our free online newsletter and get the latest news about COVID-19 or other important health stories. By subscribing to our newsletter, you'll also have regular information about our weekly podcast.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.